Am I audible and visible now? Visible so I was, but am I audible now? Okay, all right. So I said a lot of things before you could hear me, guys. If you could do the reading of what I was saying. So it was basically got delayed for this session because just now finished the special class like every day on the Unacademy app, 5 to 6. I take a special class. That's a free class on the app. So just got done with this and I absolutely forgot that I had a YouTube live class. Was so much engrossed in the topic of cardiology. So we are starting with this session now, radiology investigations. Now, why am I taking this? Because very, very important. We have seen in the recent exams, you get a lot of questions on identify what investigation is this. NEET PG had a question, INICT had a question, FMG had a question, like INICT had a question on so related to this topic, if I have to tell you what were asked, like it was asked in INICT, identify the MRI sequence, the SWI. The recent FMG exam had the question on identify whether it's a CT or MRI and the image of polycystic kidney disease. Previously, the NEET PG, you've had a question on identify the investigation, like identify this is ERCP. So that is why it's very, very important to know this and have these investigations at one place so that you can revise them later on. All right. So let's start with this. And again, a reminder for those who are new here, February 26th, you have the All India mock test. It's a free mock test. The unique feature of this mock test is you'll get the video solutions to the questions once you've given the test. And on 19th of February, this Sunday at 6 p.m. you have combat. Now what is combat? Combat is once in a month. You have this grand battle contest sort of thing, which gives you some amazing prizes, the scholarships, the subscriptions, and the vouchers as well, if you are in the top rank. So do aim for that in the upcoming combat. And we are starting with the new batches. We have started rather on 11th. All the new batches have started, be it for 2023 next students, NEET PG 22 students, last 3 months, this is your go-to batch. Everything will be there. The theory, the MCQs, IBQs, PYQs, test and discussion, everything is included with good breaks also in between for your self-study. The FMG students, we are also starting with December batch. We have started on 11th February. By October, the syllabus will be complete, 9 months. And we have for the June students as well. All right. And yes, before I forget, you have the iconic Bonanza offer running, which is only till 16th, that is day after. And this is valid for the first 3,000 subscribers. You have significant savings if you take an iconic subscription. Iconic is basically Unacademy with Prep Ladder. So if you do that, you'll get significant savings as well. Now let's start. All right, the PDF for this session, I could have actually shared it before the class. Never mind, I'll do it after the class and I'll share the PDF with you for this. Okay. So first of all, identify whether this is a CT, because this is how the images are in real life. It's not just one image. You get the entire film. Is it a CT? Is it a MRI? What do you think is this? It's a CT. Is it contrast or is it non-contrast? What do you think? Is it contrast or is it non-contrast? Good, very good. All of you say it's a CT, but it's a contrast or non-contrast? Let me zoom in if you are not able to see this well. Let me zoom these images and show you whether this is contrast or non-contrast. Okay, so if you answer it incorrect, I'm happy. I'm being very brutal there, cruel there. But if you are incorrect, then I can, assure that by the end of the session, all of you would know this is contrast or non-contrast. See, this is a CT scan because the bone is white. The concept of CT scan is nothing but an investigation basically which utilizes X-rays. CT scan utilizes X-rays. So that is why the bones would be white in CT scan. The bones would be white. Particularly look for the bone cortex to be very specific. X-rays है तो इसीलिए CT scan में radiation exposure भी होगा. Okay, there would be radiation exposure. In contrast, in MRI, the bone cortex would be black. Okay, this is the basic that I want each one of you to understand and remember. CT is X-rays, bone cortex white. MRI is not X-rays, the bone cortex is black. The bone cortex does not give signal. Now here, since the bone is white, like you are seeing here, the bone is white here. This is a CT scan. And why is this a contrast scan? Because you can see the vessel here. Okay, you can see the vessel here. The vessel here, it is white. That means it's containing the contrast. Okay, the vessel is white, so it's a contrast scan. Okay, so this is a contrast enhanced CT. Now let's go to this one and tell me, what do you think is this? Is it a CT? Is it a MRI? Or the same machine can be used for both CT also and MRI also? What vessel was that, Nuzat? You tell me. That was middle cerebral artery that I showed you. Right. So first of all, remember that CT scan and MRI cannot be done with the same machine because the principle is different. One uses X-rays, one does not utilize X-rays. So it's definitely going to be different machines. And this is a CT scan machine. Again, this question has been asked previously in the exam. This is a CT scan. Why this is not a MRI? Because if you or any of your relatives have undergone MRI, you know that it has a long tunnel into which the patient goes into that tunnel sort of thing, like you have here. MRI is going to have a long tunnel like this, like you see here. The patient goes inside this. It's a long tunnel. And that is why many patients have this claustrophobia. They are afraid of undergoing MRI. CT scan mein there's no this problem because it's just this one circle. You can see through this circle, पीछे की दीवार दिख रही है room की. That means it's not a long tunnel. This is a CT scan. Okay, this is a CT scan and this is a MRI which has a long tunnel. Another important clue here, MRI mein we use these coils which are used to excite the protons. MRI is based on which element in the body? Another question. It is based on protons. So we need to excite these protons. For that we use this coil like you see here. अगर MRI brain कर रहे हैं तो we use this coil. If we are doing MRI abdomen, the coil would be placed there. If it is MRI knee, the coil would be placed there. Okay. So remember, that's the difference between CT and MRI. Okay, that's the difference between CT and MRI. Going to next one, image A and image B. Tell me, what do you think is image A and image B? Both CT, both MR, one is CT, one is MR. What do you think? CT and MR, right? Okay, all right. Very good. Yin, super awesome. That was the specific answer there. Now, see here, as I said, whenever you are asked about it's a CT or a MR, the thing that you are supposed to look at is the bone cortex. What do you see here in this image is, this is the bone. Okay, this is the skull bone that is white. It's a CT scan. Look at this image. Even though you see the white covering here, please remember that it is not the bone. This is the fat in the scalp which is appearing white. Fat appears white on MR, T1 and T2 weighted MRI. The bone is this, just outside the brain parenchyma. This black line, the thin black line that you see, that is the inner table of the skull. The outer black line is the outer table of the skull. And beach mein the white color that you see, that is the bone marrow, the diploid space containing fat which is appearing white. Fat is white on MR. So always look just outside the brain parenchyma. If there is this black line, that is the bone cortex which is black, and that is why it is MRI. Just outside the brain parenchyma, you see the white line. You don't see the black line, so it's a CT scan. Also appreciate this, कि bone के बाहर you can see this black outline. That is basically the fat of the scalp. You can see that fat appears black on CT because it has negative HU value. It is less dense. This is the fat on MRI. It is white on MRI. It is black on CT scan. So focus on the bone. Okay, focus on the bone. All right. Can't see the pointer. I'll see next time if it's visible or not. Okay. ठीक है. Okay, now identify this one. Is it a CT or is it a MRI? Are you able to see this now? I hope the pointer is visible now. What do you think? Is this a CT or is this a MRI? Very good. Now that you see this black line just outside the brain parenchyma, there is the black line. Do not get confused by this outermost white line. You have the black line inside, so that tells you that this is MRI. This is MRI. We have discussed in our plus classes what sequence of MRI is this. This is a T2 weighted MRI. Why? Because T2 is World War II. WW2, that means water is white on T2. Okay, water is white on T2. So this is the water, this is the lateral ventricle, these are the sulcal spaces containing the white CSF. This is a T2 weighted MRI. Okay, this is a T2 weighted MRI. Look at this one. Okay, image A and image B, a very important image to understand the concept of CT and MRI. What is A and what is B? A is CT, B is MRI, A is MRI, B is CT, both MR. What do you think is that? Yes. So do not get confused here, guys. Do not get confused. This is the white line that you see here, that is the bone cortex. The white line that you see here, that is the bone cortex. The bone cortex is white. Even though the bone ka andar wala part is looking black, do not get confused by that. Always check the cortex. The cortex is white, it's a CT scan. Here, this is the bone. The bone looks white, but look at the bone cortex. The lining of the bone that you are seeing, that is the bone cortex. The bone cortex is black, it's a MRI. So remember, this is a CT scan and this is MRI. Now, why is the bone ka andar part appearing black here in the CT scan? Again, the same concept. It is fat. Bone marrow could be red marrow, it could be yellow marrow. If it's a yellow marrow fat appears black on CT scan. This is the fat in the marrow. Fat appears white on MRI, T1 and T2 weighted MRI. Until and unless I do a fat suppressed MRI sequence which suppresses the fat will not look black, right? So in musculoskeletal MRI, those fat suppressed sequence, that is stir sequence, is very, very important to pick up the bone marrow edema. Okay, remember that. कि आपको fat को you'll have to suppress so that the edema, becomes very obvious. So remember, this is the white bone cortex. It's a CT scan. This is the black bone cortex. This is the MRI. Very, very important. Okay, very, very important. Next one, a quick review of your MRI sequences here. Okay, in 5 minutes, we'll quickly see the MRI sequences. Many of you already know that, and many of you don't know it yet. So let's quickly revise that. So remember, when you identify the MRI sequences, okay, when you are identifying the MRI sequences, the first thing to be looked at is water. Always check for water. Okay. If the water is white, it's a WW2, World War II, that is T2 weighted MRI. If the water is not white, okay, if the water is not white, that means the water is dark, the water is black. The next thing you look for is what is the next thing that we look for if the water is not white? What is the next thing that we should be looking for? After water, the next thing to be looked for is the white matter. Okay, look for the white matter. Okay, look for the white matter. What will you see in the white matter? If the white matter is white, okay, if the white matter is white, white matter white, gray matter gray, that means white matter is white Anatomy is being followed. Ki white is white. Anatomy is your first year MBBS subject. So remember, it's a T1 weighted MRI. Okay, it's a T1 weighted MRI where you have white is white. If the white matter is also black, that means it is not white. That means you see here ki water is black, white matter is black. That basically means it is all black, right? So basically in this sequence, it is all black. White matter also, water also. So it is a flare sequence. So remember that flare is all black. Okay, flare is all black. So look at the sequences here. Just the crux of what we learned. T2, T1 and flare. T2 is water white, right? It's World War II. T1 first year subject anatomy. It is white matter, white. Flare is all black. Nothing is white in flare. Nothing normal. Okay. So look at this one. All these are MRI. You see the black line, and the black line. The bone cortex is black. It's a MRI. Now look at these sequences. Where is the water white? In the middle image. This is the water in the ventricles, the water in the sulfur space. Water white. It's a T2 weighted MRI. Now the rest of the two images, where is the white matter white? Which is the white matter? Which is the gray matter? The outside cortex, that is the superficial, the gray matter. The basal ganglia are the deep gray matter, right? So this all that you see is the white matter, which is going like this. The corpus callosum, this is connecting the two hemispheres. It is the white matter. So here the white matter is white. Anatomy, T1 is followed, T1. Now here water also black, white matter also black. So it is all black. So it is a flare. Okay, it's a flare sequence where it is all black. Okay, so it's a flare sequence. Clear with everyone? So how do you identify T1, T2 and flare? If I go back to the image here, this MRI that we saw. Now based on what we learned, tell me what MRI sequence is this? Is this T1, is it T2 or this is flare? Is this T1, T2 or flare? The water is not white, so it is not T2. Okay, the water is not white, so this is not T2. White matter is white. Anatomy followed. Very good. It's a T1 weighted MRI. Look at this one. We already discussed the water is white like you see here. It's a T2 weighted MRI. Okay, it's a T2 weighted MRI. Going to the next point here. So everybody clear with the MRI sequences, the basic T1, T2, flare. Okay, these are the basic that we should be knowing. The advanced ones, SWI vagera, I'll cover in the tomorrow's class. Alright, we'll have tomorrow also the continuation of the investigations. Now look at these images. Image A, image B and image C. What do you think? Is it a CT or is this a MRI? All of these are CT, one is CT, one is MRI. What do you think about these images? Very good. So all of these are CT. I hope you can appreciate the bones here. The bones are white, right? You can see the bones are white. This is the bone which is white. This is the vertebra ka part which you can see here white. These are the ribs here which are white. So all of these are CT scan. Is it a contrast or a non-contrast CT? In front of the vertebra here, look at the aorta. Look at the kidneys. They are white. Vessels white, kidneys white. It's gonna be your contrast enhanced CT. So look for the vessels and look for the kidneys. If they are white, it's a contrast enhanced CT. Okay, it's a contrast enhanced CT. Okay. So all these are contrast enhanced CT. Let's go to this one. Image A and image B. CT, MR, MR, CT, both MR. What do you think is that? CT and MRI. Okay, that's great. So majority of you have got this right. See, what do we see here? This is the vertebra, right? Look at the vertebra. The cortex is white, even though the bone marrow might look black. These are the ribs that we are seeing here. These are the ribs. The bone is white. This is a CT scan. Look at this one. Look at the vertebra here. It is not white, so it is MRI. Okay, so it is MRI. Look at the aorta here. Is this a contrast CT or is it a non-contrast CT? The aorta is not white, so it's a non-contrast CT. Okay, this is a non-contrast CT. Clear with everyone? So that's a non-contrast CT and that's the MRI that you are seeing there. Okay. Okay, this is interesting. Tell me, what do you think is the image A and the image B? CT, MR, MR, CT, both MR. What do you think is this image showing? What is HRCT difference, Nozat? HRCT is high resolution CT. The only thing is the parameters that we are using to take the images. The CT machine is the same. HRCT is used. Okay, I'll cover HRCT also tomorrow to show you that the concept of HRCT. HRCT is used where you have air surrounded by bone. So lungs में, temporal bone में, PNS में वहाँ use करते हैं. Both MRI? No. Both CT? No. So see, always check the bone cortex, not the bone entirely. This is the bone cortex, right? The black line that you are seeing, always check the black line दिख रही है bone के outer में. If you can see the black line there, it's the bone cortex which is black. So it is MRI. Okay, it is MRI. Here, look at the bone cortex, the white lining of the bone. Okay, this is the posterior element, the white. This is a CT scan. Okay, so this is MRI and this is CT scan. Okay, this is MRI and it is CT scan. Clear with everyone? Always remember this. Always check the bone cortex. That is where we tend to make a mistake. कि ये bone white दिख रहा है तो ये CT scan है. No, check for the bone cortex. The bone marrow is appearing white because it is containing fat. Okay, because it is containing fat which is white on MRI. Next one, image A and image B. Both CT, both MR, one CT, one MR. What do you think? Very good. Both of them are CT. Image A is a non-contrast CT. Image B is a contrast enhanced CT. In both of them, you see that the vertebra, the bone is white. It is CT scan. Look at the aorta. Look at the aorta. The aorta is white here. So it's a contrast enhanced CT. The aorta is not white here. It's a non-contrast CT. Okay, it's a non-contrast CT. That is the difference between the two. How do we give contrast for a contrast enhanced CT? How do we give contrast? It is given IV, intravenous contrast. So intravenous हम contrast देंगे, ये जाएगा heart में. From the heart, it will go to the rest of the vessels and the rest of the body. So the vessels will become white. Now, what is the importance? Why do you want to do a contrast enhanced CT is what is explained by these images. So in the CT scan, this structure that you are seeing, is it the liver or is it the spleen? This is the right side. Your left is the patient's right. Your right is the patient's left. So this is basically the liver and this is where we have the spleen. This is the stomach here. In the non-contrast CT, we are not seeing anything in the liver. When we did a contrast scan, same patient, there are some lesions that we are seeing which are looking different from the rest of the liver parenchyma. So it is not like that suddenly this patient got the lesions. The lesions were present in non-contrast CT as well. But why are we not able to see in the non-contrast CT? Because their density is like the adjacent liver parenchyma. So they have got camouflage in the liver parenchyma. Okay. Now, when we give contrast, every lesion has different pattern of enhancement. For example, HCC will have early arterial enhancement. It is supplied by hepatic artery. That helps us to pick up HCC. So remember that the point to be learned here is that a contrast scan is very, very important and essential for any space occupying lesion. What do I mean by a space occupying lesion? It could be a tumor, right? It could be an abscess. So whether the pathology is infective, inflammatory, or a tumor, a space occupying lesion, abscess, a contrast scan is very, very important. Be it a contrast CT or be it a contrast MRI. Okay, the contrast scan is very, very important. Give me a minute. Okay. Right. So remember that, okay, I'll show you the difference between oral and IV contrast. So remember, the contrast scan is very, very important for any space occupying lesion, infective, inflammatory pathologies. Okay, very, very important. Next one, look at the image A and look at the image B. Both CT, both MR. What is the difference between the two images here? In brain, how do you identify whether it's a non-contrast or a contrast? Very good. Both of them are CT scan. You see that the bone is white. What is the difference? Now, in this first image, you are not seeing the white vessels in the sulcal spaces. In the second image, in the sulcal spaces, you can see these white vessels. That tells you that it's a contrast scan. So this is a non-contrast CT. This is a contrast enhanced CT. In the brain, the vessels in the sulcal spaces, in the cisterns, they will appear white. Okay. So that is how you identify non-contrast CT and a contrast enhanced CT. Okay. Okay, what do we use as a contrast, Devar? Urographin? No. Remember, what is the contrast that is used? When I say that we do a contrast scan, it is for CT and for MRI. For CT scan, we use iodinated contrast. For MRI, we use gadolinium K compounds in chelation. Iodinated urographin is iodinated, but it's an ionic contrast. It is high osmolar. The contrast that we prefer is low osmolar iodinated contrast, which is non-ionic. So that is iohexol is the one which is very commonly used. It is relatively safe for the kidneys also. So we prefer using iohexol because it is low osmolar, non-ionic. Urographin, it is high osmolar and it's ionic. Okay. Next one. Tell me the difference between the two, image A and image B. Okay, very good, Mosey. I'll come to your doubt. Those white color dots in the image A, I'll come after I discuss this slide. I'll come to your question. Okay, so Dr. Zoya, I'll answer your question as well. Shoaib, CT may remember it is iohexol. Gastrographin, urographin were used previously before iohexol was not available. Iohexol is more safe, so now we prefer using iohexol. See, absolutely right. Both of them are CT. The bone is white. This is not contrast CT. This is contrast enhanced CT. So can you see those white, basically enhancement here? This is the shaggy, the irregular enhancement in the cisterns. Okay. This is a non-contrast CT. You don't see the contrast in the cisterns or the sulcal spaces, right? Anyone, what do you think is the diagnosis here in this image? What do you think? When you see this image, what diagnosis would you think of? This shaggy enhancement, irregular, thick enhancement in the cisterns, in the sulcal spaces. Think of meningitis. Okay, think of meningitis. See, Anisha, this is not subarachnoid hemorrhage. If this would have been a non-contrast CT and you see this white color, I would call it subarachnoid hemorrhage. This is on a contrast scan, and even in that, there is very irregular enhancement. Remember, this is meningitis. Tubercular meningitis is how this will look like. Okay, tubercular meningitis. So always remember, in a patient of meningitis, contrast CT is very, very important to look at this abnormal enhancement in the meninges. Otherwise, we will not be able to pick up the meningitis component. Okay, so that's the role of CT scan. I'll go back to Mosey's question. I think you were asking about this. What are those two circle dots, the white ones? Can someone tell me what are these? Can someone tell me what are these two circle dots there? Normal or abnormal? I tell you that. Okay, Anisha, again I'll come to your query. See, correlate your anatomy. Pineal gland एक होता है कि दो होता है? Pineal is one or two? Only one. Where are we seeing? This is bilateral symmetrical white color. White on CT, white like bone. This is basically calcification. So can it be pineal? No, because pineal is only one, but we are seeing two. So this is not pineal. Where is the pineal present? Anatomy wise, relation to the third ventricle. Where is the pineal gland present? It is related to what wall of the third ventricle? It is present through the posterior wall of the third ventricle. Where is the third ventricle? Right in the midline, slit-like structure. These are the lateral ventricles opening into the third ventricle. थर्ड वेंट्रिकल के पीछे यहाँ पे दिखेगा आपका पीनियल. ओके, सो द पीनियल वुड बी लोकेटेड हियर. So this is where you would see the pineal calcification. This calcification bilateral symmetrical. This is basically within the lateral ventricle because the lateral ventricle is very small size here. We are not appreciating. अगर आप very closely if you see, you would be able to see the lateral ventricle के horns के अंदर है ये. Okay, so this is your choroid plexus calcification. Choroid plexus of the lateral ventricle present in the trigonal region, the posteriorly. Okay, so that is your choroid plexus calcification. Now, definitely in the upcoming sessions, I can understand that many of you are facing difficulty in the anatomy in the CT and MRI brain. We will cover that. Okay, so that is your choroid plexus calcification, which is a normal physiological site of calcification. Nothing to be worried about. All right. And someone else, I think Zoya, you asked that why do you want to do a contrast enhanced CT? Number one, the image which I showed you, कि liver में दो lesions थे, which were not seen on a non-contrast CT. So if you just do non-contrast CT, these lesions will be missed. Contrast helps differentiate it from the adjacent parenchyma. So to identify these lesions, to see how many, to see the size, to see their boundaries, this contrast is very, very important. So basically, as the term says, contrast gives the contrast to the abnormality, right? The abnormality looks different from the surrounding structures and it can be picked up well. So for example, if I give you an example, let's say कि यहाँ पे ये व्हाइट ये रेड कलर के मैंने मल्टीपल सर्कल्स या ओवल बना रही हूँ मैं यहाँ पे, राइट. आई एम मेकिंग ऑल ऑफ देम रेड कलर. If all of them are of the same color, they all will merge together and we will not be able to identify. Suppose now I change that one of the circles from the red color, I change it to green color. Now can you see that how it is standing out in the background of the red? That is what exactly happens with the contrast scan. It makes it so obvious in the surrounding background. So to identify the pathologies very well, we need to give contrast. You know, it's like if everybody is a Negro, all black, they all look the same. On some black के बीच में if I put one, you know, very fair person and American, बीच में डाल दिया, that will stand out. So that is what is the black and white contrast in radiology. Radiology is all dependent on that black and white contrast. How do you increase the contrast in between the two adjacent structures? That defines how do you identify it very well. So I hope Mozi and Zoya who had the query here, that's clear. Okay, this is choroid plexus calcification and that's the role of CT scan. Okay, that's the role of CT scan. Again, look at these images. I think, yes, this is the last image and I'll continue the session of radiology investigations. We have many other investigations to be discussed. I'll continue it in the tomorrow's class. Again at the same time at 6 p.m. Okay. Okay, Nuzat, I'll explain vertebra in CT and MRI together. Very good, Kirtika. This is a CT. You see the white vertebra. This is the white vertebra. Both of them are CT scan. This is the aorta. This is the aorta. Aorta gray color, aorta white color. So this becomes contrast enhanced CT and this becomes non-contrast CT. So NCCT and CECT, right? That's the difference between the two. If you look at the image very, very carefully, look at this. Where is the pathology? Look at this one. Is this visible? The pointer is visible. Let me check. think the pointer is not visible here, so I need to go back to the size. All right. Uh, where do you see the pathology? Anyone has picked up? Does anyone have a radiologist eye here? कि contrast में कहाँ pathology दिख रहा है? देखो ये लिवर नॉन कॉन्ट्रास्ट में है, ये लिवर कॉन्ट्रास्ट में, इट्स यूनिफॉर्मली द सेम, इट इज नॉर्मल, द लिवर इज नॉर्मल, इवन द स्प्लीन इज टेकिंग अप द कॉन्ट्रास्ट, राइट? Look at this structure. What do you think is this structure here? This is gallbladder located here. Fluid density gray color, that is the gallbladder. Can you appreciate the difference in between the two? Yes, Zoya. See, look at this one. There is something enhancing in the gallbladder attached to the gallbladder wall. This is not a calculus, right? Non-contrast में देखो यहाँ पे कुछ significant बहुत नहीं दिख रहा है, बहुत subtle है. It is becoming white on a contrast scan. When something is gray and then it is becoming white on a contrast scan, that means it is enhancing. That means it is picking up the contrast. Absolutely right. So that is a gallbladder polyp there. A calculus will not enhance, right? A polyp will enhance. So this is basically the gallbladder polyp. So can you see that how the contrast helps us pick up the pathologies, right? Tell me, what is this here? What is this structure here anatomically? What is that structure there? It is pancreas. Absolutely right, Ian. This is pancreas. Okay. So going from the right side towards the left side, towards the spleen it is going. That is pancreas. Okay, that is pancreas. So now, Nuzhat, coming to your query, the vertebra. What is the exact query in your CT and MRI में vertebra? Are you asking about this axial images? These are called as axial images, right? हमने horizontal sections लिए हैं. Look at the vertebra, the bone cortex. It is white here. This is the vertebra here, which is black. So CT and MRI. This is where you have the spinous process पीछे. Okay, you have the spinous process. Which other section? This one. Are you talking about this? What section is this called as? This is called as the sagittal section. Okay, side से हमने लिया है. This is the sagittal section that you have. This is the vertebra. The bone cortex is black. This is the vertebra. The bone cortex is white. Vertebra, ये body है. ये जो पीछे दिख रहा है, the posterior elements, the spinous process. Look at the black cortex. Okay. In between the two is where you have the vertebral canal, right? आपका spinal cord जाएगा जहाँ से. This is the posterior element, the spinous process. The bone cortex is white. This is a CT scan, right? So here, like you see in the axial section, this is where you will have the spinal cord between the body and the spinous process. This is where you have the spinal cord between the body and the spinous process, right? So this is where you have the spinal cord in दोनों के बीच में. Nuzhat, is that clear? Any other query here? Shem, I mentioned in the beginning, you have a video on neurocutaneous syndromes already there on the YouTube channel. Just search for it. Everything in detail has been covered there. All right, sure. So this is going to be covered in the tomorrow's class. Many other investigations. I think we might need 2 more sessions to discuss many other investigations. How do you identify mammography, DEXA, CT angio, MR angio, DSA, ERCP, MRCP, T-tube, PTC, right? Then your IVP, RGP, IVU, right? Your ASU, MCU, PET-CT, contrast enhanced ultrasound, Doppler, all of that will be discussed in the upcoming sessions. So tomorrow, 6 p.m., if there's a change in the time, I will let you know. Tomorrow, we will have the rest of the radiology investigations that we will be discussing. Okay? हाँ, so no, sir, good question. एक वाला जो मैंने आपको ये इमेज दिखाया था, this one where the vertebra is completely white, right? So how white is the vertebra or how white is the bone? It depends on what is the content of the bone inside. If the bone marrow is fatty with age, the red marrow is replaced by the yellow marrow. It will become darker with age, right? If it's a young patient, a child, जिसमें bone बड़े dense हैं, उसमें आपको vertebra पूरा white दिखेगा. So after, it depends on the bone density. It is red marrow or it is the yellow, okay, the yellow marrow, okay. Is that clear, Nuzat? I hope your query is solved. So just look at the bone cortex and nothing else to identify whether it's a CT or it's a MRI. All right? Okay, so I'll meet you again tomorrow at 5 p.m. guys for KBMD and mnemonics that we are doing. Very, very important for your upcoming exams, be it FMG, be it NEET PG. 5 p.m. free class on the app, and then 6 p.m. you'll have the YouTube session. Okay? Yes. Thank you so much, everyone. Goodbye. Take care and keep studying, keep revising, and keep